Good morning. First and foremost, now is not a time to panic. The city of Miami has been actively planning for the possible impacts of coronavirus for several weeks. Our emergency managers are working diligently to keep Miamians safe. They're also working with state and federal health authorities to stay up to date on this evolving situation. Our emergency management professionals are participating in regular update calls with the Florida Department of Health, and they are closely following the guidance of the U.S. Center for Disease Control. Our Division of Emergency Management will coordinate citywide efforts, while the Division of Health and Emergency Medical Services will liaison with subject matter experts, guiding response policies and procedures. The Department of Fire Rescue has established a protocol for 911 dispatchers related to emergency infectious diseases. Our call takers are prepared to handle emergency calls related to COVID-19. Right now, it's simply about having a good plan. Outbreaks will not necessarily occur at the same time. We are treating this as we would be preparing for a major storm, meaning an outbreak may or may not affect us. As this situation evolves, the city of Miami will adjust accordingly. Rest assured, we will keep the public updated on our efforts and inform you of any measures that may become necessary. As far as we know, we have not received any reports of any cases of COVID-19 in the city of Miami. For now, here's what you can do. As has been reiterated over and over, avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth with unwashed hands, and wash your hands often with soap and water for at least 20 seconds. If soap and water aren't available, use an alcohol-based hand sanitizer. Check the label and make sure it's at least 60% alcohol. Our emergency management professionals and the entire city team are working hard to keep you safe. For the latest information, we encourage everyone to visit cdc.gov and the Miami-Dade Department of Health. For Ultra and other mass events, we will be following the CDC recommendation as it relates to issues or advisories of mass assembly, holding meetings with event organizers. However, if you are sick, we ask you to stay home and we ask you to limit your person-to-person exposure. We are also asking Ultra to update its life safety plan to take into account the coronavirus and its effect from the fact that it will have people who are, according to its website, traveling from 105 different countries throughout the world. Primero y principal, esto no es un momento de entrar en pánico. La ciudad de Miami se ha estado preparando activamente para el posible impacto de coronavirus durante varias semanas. Nuestra división de manejo de emergencias está trabajando diligentemente para mantener seguros a los residentes de Miami. Nuestra división de manejo de emergencias está... I think I already read that part. I gotta read it. The next one. También están trabajando con las autoridades de salud estatales y federales para mantenerse al día sobre esta situación en evolución. Nuestros profesionales de la División de Manejo de Emergencias participan en llamadas de actualización periódicas con el Departamento de Salud de la Florida y también siguen de cerca la guía de los Centros para el Control de Enfermedad de los Estados Unidos. Nuestra División de Gestión de Emergencias coordinará los esfuerzos de toda la ciudad, mientras que la División de Salud y Servicios Médicos de Emergencia se vincularán con los expertos en la materia que guían las políticas y procedimientos de nuestra respuesta. El Departamento de Bomberos ha establecido un protocolo para el personal encargado de contestar las llamadas del 911 relacionado con enfermedades infecciosas como lo es el COVID-19. Ellos están preparados para atender este tipo de llamadas. En este momento se trata simplemente de tener un buen plan. Estamos tratando esto como si nos estuviéramos preparando para una tormenta, lo que significa que un brote puede o no afectarnos. A medida que esta situación evoluciona, la ciudad ajustará su respuesta debidamente. Tenga la seguridad de que mantendremos informados al público sobre nuestros esfuerzos y le informaremos sobre cualquier medida que pueda ser necesaria. Por ahora, esto es lo que puedes hacer. Evite el contacto cercano con personas enfermas. Evite tocarse los ojos, la nariz y la boca con las manos sin lavar. Lávense las manos a menudo con agua y jabón durante al menos 20 segundos. Si no hay agua y jabón disponibles, use un desinfectante para manos a base de alcohol. Revise la etiqueta y asegúrense de que contengan al menos 60% de alcohol. Siga las actualizaciones de la cuenta oficial de redes de la ciudad de Miami y el Departamento de Bomberos. Y por último, pero no menos importante, no se asusten. Nuestros profesionales de emergencias y todo el equipo de la ciudad están trabajando arduamente para mantenerlo informado. Nuestros profesionales de emergencias y todo el equipo de la ciudad están trabajando arduamente para informarlo. Para obtener la información más reciente, exhortamos a todos a visitar cdc.gov y el Departamento de Salud del Condado de Miami-Dade. Now, I'll be open to questions. Correct. We have not been informed that any of those cases are in Dade County or in the city of Miami. It doesn't mean that they're not, but we have not received that information from the governor's office at this point. We are going to hopefully be talking to him before the 2 p.m. press conference. Yeah, what we're looking at is mass aggregations of people. In the case of Ultra, it's particularly different because many of those mass aggregations, as opposed to, say, for example, Miami Heat game or any other Wynwood or any other area where there's a mass aggregation of people, are specifically from people who are traveling to Miami. So there's a lot of components that are involved. One is what is the airport doing? Secondly, what is the federal government doing in terms of its restrictions from people flying to the city of Miami? And third, as I mentioned, we are already actively reaching out to them to get them to update their life safety plan. And we're obviously monitoring this on a day-to-day basis. So based on those three factors and whatever the CDC recommends, that's what's going to determine how we act. What do you mean? No, we are specifically asking them to update their life safety plan, and we can have the chief, if you want, talk to that issue. But we have are requiring them to update their plan, which is something that they have to do contractually with the city of Miami. And so that's something that we can mandate from them, and we're obviously looking at what are the contractual obligations that the city has currently. Yeah. Well, I mean, I think, we're monitoring on a day-to-day basis. Right now, we don't have any cases in the city or in the county, but what makes Ultra different, like I said, is that it is an event that brings people from across the world. I mean, according to their website, 105 countries. Obviously, the CDC in combination with the airport and with the federal government are analyzing whether people can even travel from those countries. So irrespective of whether they have bought a ticket, irrespective of whether they have any infectious condition or not, they may not be allowed to travel from that country, and that's something that the event would have to deal with them. In terms of our response at this point today, we are working with them. They have to update their life safety plan, and based on that, if it's something that is to our satisfaction, we obviously have input as to whether or not we approve their updated life safety plan, and that's something that our fire department has done a magnificent job, I have to say, getting ready for any potential outbreak. We'll be analyzing it with their organizers. We have just told them that we want them to update their life safety plan, so we have not received that plan yet. Joe, it's too early to tell. I mean, they haven't actually given us a life safety plan yet, but anything is possible, obviously, based on either the life safety plan or based on a variety of other contingencies. And we'll be working with them day in and day out. Well, the first protocol that we have is an enhanced 911 system where we ask very specific sets of questions to see if someone needs an enhanced level of service. We have a variety of equipment that I'll let our fire department speak to because they're very technical in nature that would allow us to respond and also keep our first responders safe so that they also themselves do not become transmitters. En este momento no tenemos información sobre de que si los 185 personas que se están monitoreando están en el condado de Miami-Dade o en la ciudad de Miami. No nos han dado esa información. Estamos en el proceso de establecer contacto con la oficina del gobernador del estado de la Florida y obviamente estaremos monitoreando la conferencia de prensa a las 2 de la tarde. Hay varios eventos grandes en la ciudad de Miami en el mes de marzo y estamos analizando todos esos eventos, en particular el evento de Ultra, por razones de que a base de su información en lo que son las redes sociales de ellos, hay personas que vienen de 105 países en el mundo. Así que tenemos que monitorear eso, no solo nuestra respuesta como ciudad, pero también el hecho de que ellos tienen que conformar con las reglas del aeropuerto, del gobierno federal, que posiblemente va a poner restricciones de personas que no pueden viajar de ciertos países en el mundo. Así que eso todo va a ser parte del análisis para nosotros, pero también le estamos pidiendo a ellos que ellos nos manden a nosotros un nuevo plan de life safety, de seguridad de las personas, para que nosotros lo podamos analizar en conjunto con esta amenaza. Bueno, nosotros tenemos bajo el contrato el hecho de requerir de ellos que ellos no tienen que mantener a tanto de todos los tipos de seguridades que ellos van a tomar para asegurar que el evento se puede llevar a cabo sin ningún asunto. Eso obviamente se evoluciona a base de cuáles son las amenazas. En este caso, tenemos esta circunstancia con el coronavirus, y eso tiene que ser parte del plan nuevo. porque es una amenaza nueva en cual nosotros tenemos que lidiar con. Déjame terminar con la pregunta de ella, entonces voy a la tuya. Mira, estamos monitoreando esto. En este caso no tenemos un caso del virus aquí en el condado ni en la ciudad, entendiendo que todas las decisiones que tomamos nosotros tienen un impacto sobre la calidad de vida y la protección de nuestros residentes y también tiene un impacto económico. Así que estamos monitoreándolo día tras día. El hecho de que hay 8 es un evento en el cual hay una gran congregación de personas y eso sin duda eleva lo que es las preparaciones nuestras y la preocupación nuestra. No sabemos todavía qué tipo de impacto esto puede tener sobre la economía ni sobre turistas. Sin duda nosotros recibimos impuestos sobre la gente que vienen aquí y que gastan dinero aquí en los hoteles nuestros, pero en este momento todavía es demasiado temprano para saber exactamente qué tipo de impacto va a tener a nosotros. Bueno, lo que le puedo decir es que nos estamos preparando de una forma muy amplia. Estamos tomando cualquier amenaza seriamente. Le estamos pidiendo a un plan nuevo que va a tener en efecto cuáles precauciones ellos van a tener que tomar para evitar que el virus se crea una contaminación masiva aquí en la ciudad de Miami. Y obviamente estamos trabajando no solo con los organizadores, pero también estamos trabajando conjunto con el aeropuerto, el condado y con el gobierno federal, que va a posiblemente suspender vuelos de países que tienen participantes al evento. Así que todo eso es parte del análisis, pero también hemos analizado el contrato para ver qué tipo de derechos tiene la ciudad de Miami, entendiendo de que esto va a tener, si tendríamos que tomar una decisión al respecto al ultra, tendría un impacto grande a la ciudad. Y yo creo que, como yo expliqué, esto es algo en cual la gente se debe de preparar. Como nosotros nos preparamos y estamos acostumbrados a prepararnos para tormentas, deberemos de prepararnos para esta eventualidad y esta posibilidad. Sin duda, el Departamento de Bomberos y Rescate ya tomó precauciones hace semanas para contratar y recibir esos tipos de insumos necesarios para proteger a los bomberos nuestros, que también protege los residentes nuestros, porque ellos tienen que responder a incidentes de emergencia médica. Nosotros tenemos protocolo en la forma en cual recibimos la llamada 911. Estamos haciendo preguntas específicas que son diferentes de las preguntas típicas. También tenemos protocolo en lo que ellos utilizan cuando responden a una llamada de esa forma y como ellos decontaminan lo que es el vehículo en cual transportan personas que pueden ser contaminados. Sure. Yeah. Yeah, so the protocol is under several fronts. The first is there is a 911 protocol to potentially identify someone who may be contaminated. Then they have a protocol in what they will wear if they have to confront someone that may be contaminated, and they also have a protocol in how they disinfect the vehicle that may respond to a call. Sure, sure, yeah.
Good morning, Joseph Zaralban, Fire Chief, Department of Fire Rescue. We have been preparing for this for approximately 2 months now, and as the mayor had indicated, we do have protocols in place. We actually this is not the first emerging infectious disease that we have dealt with, and typically what we do is just modify those policies and procedures so that they are adaptable to the specific virus that we are currently dealing with. When a call comes into 911, the mayor is absolutely correct. We develop a series of questions that we ask to ensure that we can screen any potential calls related to a possible infection. Questions are specific to travel. They have, as you know, migrated from travel to China to travel to multiple areas, but we also ask questions relative to signs and symptoms. We do this so that we can give indicators to our responding units that they might potentially be responding to an incident of concern. And what this does is it allows them to not only be aware, allows them to pre-plan, but it allows them to wear the appropriate personal protective equipment. Once they are dressed appropriately and responding, we have other triggers in place where we will start to contact the receiving hospital, the Department of Health, and outline to them that we have a possible situation. So as that plays out, again, as the mayor indicated, once we have successfully transported that patient, we will have a unit that we would need to decontaminate because it's of highest importance that we don't cross-contaminate our personnel, the ones coming on the following shift, but also don't cross-contaminate a patient that we might pick up afterwards for a broken arm or something of that nature. So we have all of the equipment and expertise necessary to thoroughly decontaminate our units and place them back into service, usually within the hour. So all of these measures are in place along with associated training that goes hand in hand with this type of response. We use this protocol on one particular instance that did not actually end up being a confirmed incident, and it was just an individual who had a family member that had traveled, but in contacting the health department and the CDC, it turns out that that individual that they came in contact with had since been cleared prior to that, so it ended up being a false alarm, but we went through all of the appropriate measures just in case. I'm not familiar with technology that the airport is using to scan individuals per se, but simple handheld thermometers to determine if an individual has a fever, and some of those don't even require person-to-person contact. So those are usually the most effective.